everyone, and welcome to another episode of the Skin and Psych podcast. I'm your host, Patricia Delgado, nurse practitioner certified in primary care, dermatology, and psychiatry, and this is where those worlds come together. Today, I have the immense honor of interviewing and speaking with Dr. Mohammad Jafferany, the president of the Association for Psychodermatology Medicine of North America, APMNA. Thank you so much for joining us, Dr. Jafferany.
My pleasure.
So what is your role with the association?
Yeah, so I'm currently the president of this APMNA for the last 3 years, I would say. And this is the association which was originally founded in 1994. And started with a small group of people, maybe around 10, 15, like that. Mm-hmm. So they used to have meetings around that time, just sit in one room and there's the meeting. And now, gradually, year by year, it has grown. And for the last 10, 11 years, I am organizing this meeting. And I can see myself that, how it's growing every year by year by year. And in fact, yesterday we had our 34th meeting. And it was attended by 110 delegates. From different countries, probably more than 22 around the world, plus local delegates. A good number of medical students and residents. We had got 18 posters presentations and 41 oral presentations covering every aspect of psychodermatology on different topics.
Yes, it was fantastic. I had the honor of being there yesterday as well. And I, too, got to speak, and thank you for that honor. I really enjoyed the wide array of topics that were presented, and I really find a lot of value in there are a lot of presentations that are heavy with a lot of data, a lot of quantitative information, but then also a lot of qualitative information. What do you look for when you're inviting speakers?
Yeah, so we try to cover every aspect of psychodermatology, starting from a simple kind of research, new research areas, some kind of focus on some systematic reviews which have been done before, and what is going on from the psychosocial aspects of the chronic skin disease in different countries, their experiences. So it is a kind of multifaceted, different topics in every area of psychodermatology to try to cover. And we also try to focus that this should be more international meeting, so that people from different parts of the world, they should come and they share their experiences, how the psychodermatological disease is manifesting in their area versus other places. So it's a very productive meeting in that sense.
Yes, and I actually did enjoy that aspect as well, because I actually was speaking later that day on alopecia areata. And during that presentation, one of the speakers from Europe mentioned that baricitinib was approved in Europe for atopic dermatitis.
Exactly.
And here in the United States, it's not.
Yeah.
And so that's just an important, piece of information for us to know here. So we know that we're not necessarily, doing anything completely outside of what we should be doing for our patients if we decide to treat someone with alopecia areata and atopic dermatitis with baricitinib.
Correct. Yeah, that's right.
Yeah, so have you been a part of the APMNA since its inception in 1994?
No, actually, I am involved since 2009. At that time, I joined. And as I told you, initially it was very small, just gathering a few people. But now, you saw yesterday, and every year, it's getting more and more. People are more and more interested. And I also get lots of emails from people around the country, particularly medical students, who are interested in psychodermatology. They want to do some research projects and want to learn more and more. So that shows that how much they are aware of this area and how much they are interested in. So that also shows people's interest in this particular field.
Yeah, that is really exciting to hear, because this is such an important topic. Are you finding that you're getting more and more emails as the years go on?
That's what I'm saying, every year by year.
Every year it's more and
year
more
by year.
and
Yeah,
more.
Okay. So very kind of optimistic and very proud of that people are, so much getting interested in this field.
That's fantastic. I'm sure next year you'll have to prepare for 200
Do
people and maybe even more countries. That's fantastic.
Yeah.
Yes. So what are your plans for next year with the APMNA?
Well, next year, as you know, this is March 18, 2027, our next meeting, San Francisco. So definitely we plan to make it more accessible to people and more people from abroad to get their experiences. And as I told you, this year we got 110 registrations, and next year we are hoping for more than that, and more social program, better social program. And I'm sure you were there yesterday, last night in the dinner. We also do a psychodermatology quiz program since last year actually. So this year was the second time.
Yes.
So that is very popular in all, particularly the learners and trainees and residents and students. They love it. So this is also a fun and as well as an education too.
Yes, that was a lot of fun.
Yeah.
I didn't know what to expect. When it said there'd be a quiz, I was like,
Yeah.
oh boy. I thought I was just coming to a dinner, but it was a lot of fun. Why do you think psychodermatology is growing in interest, and why do you think you're getting more emails every year?
I think it is people's awareness. It is getting more and more because people have now realized that there is a connection between psych and skin. So when they see that a patient with atopic dermatitis or psoriasis or HS, those kind of chronic inflammatory conditions, they not only present with skin disease, but they also shows significant level of quality of life impairment, depression, anxiety, psychosocial, pressures. So when people have started seeing that, they are getting more and more, thinking about it. Why my skin conditions are being treated, unless they don't get psychological treatment. So this concept has become more and more clear day by day. And with definitely, I would say one part we are playing the education about this field, and literature is also getting more and more topics on this particular area. So basically, the awareness is increasing, and that awareness brings more interest in people, and especially the young people when they say, this is a kind of niche field, and it is a unique, and they should involve yourself into that area. That be beneficial for them in the long run, and for their good chances for good residency match and good resume. So they try to work on that and get interested.
So the APMNA invites colleagues and professionals of all different fields. So we have psychiatrists, psychologists. I don't know if we have mental health counselors as well. I'm a nurse practitioner, and I'm also in the group, dermatologists. What is the breakdown of the professionals that you have in the organization?
Yeah, so generally dermatologists are more. I would put the ratio like 90 versus 10. So 90% are dermatologists and 10% are psychiatrists, psychologists, counselors in that area. So it's more common in dermatology who need to know the psychological part. I think that could be the reason. Because as I told you, all these conditions, they require psychological treatment along with dermatological treatment. So dermatologists are not very well equipped with or trained in that area. Just an example, like trichotillomania is a very common condition. The first line of treatment, evidence-based treatment, is habit reversal therapy. Now, this is just a therapeutic aspect of the treatment and not the medication part. So when a dermatologist knows and learns about this HRT, along with the medication part, then they will do better. So that's how they want to learn more and more about these psychological aspects of treatment.
Absolutely. And would you say that any dermatologist, whether they're passionate about psychodermatology or not, could benefit from the information that's presented at your conference?
Oh, definitely, yes. And yesterday, I didn't know you noticed or not, but there were lots of people from different halls. There were other things that were going on. They came to listen to our psychodermatology, talks. So there's also another evidence that people from other specialties or other, like in photobiology and this and that and other societies, they came and listened to our talks. That shows their interest as well.
Yep. And honestly, I feel like the topics that were in your program are relevant to so many different specialties,
Right.
so many different parts of dermatology and just healthcare in general. What is one thing that you hope the attendees of the APMNA conference took away from the day yesterday?
I think the best thing is the awareness and understanding about how psychological part is playing a major role in the whole treatment process. Now, what happens in general, many dermatologists, they do not realize the importance of the psychological aspect of the treatment. So they just treat the skin condition by the dermatological conventional treatment, but patient is not getting better. So by attending that conference and learning and getting awareness about psychodermatology, now they will think that, yes, I should do this PHQ-9 and GAD-7 questionnaires for every patient when they come to me. Now, these two questions are very basic, easily available on the internet, free, takes only 2 minutes to fill this by the patient. And even your staff, like your medical assistants and front desk staff, they should do that. And by the time patient comes to see the doctor, it should be in front of him. So that gives, because the main thing is that dermatologist or any doctor should be suspicious about the psychological aspect of the problem. Because unless you don't ask, patient won't tell you.
Right.
So this is the main thing we need to focus on. That once you are suspicious that, how's your life going? Do you think that you should be kind of away from this? You don't want to meet with anybody. You feel bad when you go to work. People look at you. Are they kind of talking about you? Like those kind of questions. So in this way, patient will keep open up. But so if you don't ask, they won't tell you. Now, if you don't ask, that means you do not have awareness about that. So the awareness is very important to understand the significance of the psychological, aspect of the problem, which is very common. They should know that. So I hope that those people who attended the meeting, they should have some kind of information, some awareness, and a take-home message that yes, we need to see every skin disease with that angle or that lens, that this patient might have some anxiety related to skin disease or depression or some OCD behavior, even psychosis. So these things they need to look at that.
Absolutely, and not jumping to conclusions or assuming anything. Like you said, if we don't ask those questions, if we don't open that door,
then you don't know that.
We'll look at someone and just have our own assumptions. But in someone's presentation yesterday, they mentioned about everyone's perception of their skin disease can be different. A person can present with one patch of hair loss of their alopecia areata, but it can feel like it's the end of the world, versus another person whose alopecia areata may be worse, but they're more stable because they're accepting it more.
Absolutely.
And their quality of life may not be as affected. And so it's important to ask these questions and not just base it on the appearance of the patient.
And at the same time, the dermatologist should be aware that this is a vicious cycle. By that means, if let's say, just an example of alopecia you just talked about, and if he is getting some treatment for his depression and anxiety associated with that, his self-esteem would be much better than without taking the medication. When the self-esteem gets better, he feels good about that, and that would treat his skin condition in that way.
Right.
And then the whole cycle was going on and on and on. So it is a vicious circle.
The psychoneurocutaneous loop.
That's right.
And it just, it makes so much more sense to treat both parts of the loop than just one. And one of the things I loved about the conference as well was actually seeing the data, seeing the MRI results that are showing the actual changes in the brain, the physical changes in the brain that occur when patients are being treated for their skin disease and or their mood disorder or their psychiatric condition. So that was really interesting, actually seeing the science.
Exactly. Yeah, that was the beauty of the conference, variety of topics at every level, in the molecular level, and you saw these MRI images in delusional parasitosis, and the very nice pictures. And one topic I really liked very much was public health.
Oh, yes.
Yeah, the skin and public health. Yeah, so that was a wonderful topic.
Yeah, and that's kind of touching on getting the word out to more people.
Yes,
and
exactly,
destigmatizing mental health.
Yeah.
Psychodermatology is growing in popularity. What different types of training exist for anyone that's interested in growing in psychodermatology education and knowledge?
Yeah, that's a very great question. I always get emails from different people from every level, from medical students, residents, from dermatologists from different countries, that how can we get training in psychodermatology? What are the opportunities available? Is there any fellowship available or any kind of training diploma or something like that? So the current situation is that we in the United States, we don't have any typical fellowship or any training program for psychodermatology. However, in Europe, there's a psychodermatology diploma, which is being offered by European Society of Dermatology and Psychiatry. So if you remember, there was one topic on that area was in the lectures. So they have, it is from, I think, about 9 months. It starts from June until, no, from September until June. There is a time frame. So it is an online event, free, not free actually. You have to pay for some fees, I think. So that is one way to get some, so-called diploma on that field. But here, I always advise the people that if you are, yesterday many people, even in the dinner, many people they asked me that how can we involve in this field? We are very excited, we were fascinated with what we saw today. So I always tell everybody that, being a student or resident at this younger level of your training, you should involve yourself into psychodermatology by attending these kind of meetings and some seminars, symposia to get more and more about this field. And then in my capacity, what I can do, we can do some kind of research projects together. In this way, you'll get involved into that. And who knows, maybe in the next few years, we here start a kind of a training program or fellowship type of thing in psychodermatology. But it is kind of far away in the pipeline. But we can be very much optimistic and hopeful about that.
Absolutely.
Yeah.
And so you were saying that anyone interested in psychodermatology should definitely attend the conference.
Attend the conference.
Are there any other ways that people can get involved with the APMNA?
Yeah, I mean, they can involve into the committees for this APMNA. It's a huge conference now, I would say. There's a lot of work. So, you saw last night that many people were, particularly the students, were involved in different fields, So they should involve them and themselves into those kind of activities. And some dermatologists, they want to be involved into a kind of board of directors of APMNA. They want to involve more and more to do something. So there are lots of chances and options you can involve yourself. And show your interest. That is the main thing. If you really like this field, you involve yourself in this field. Then you would get to know something. So our arms are open for everybody to join APMNA and put your share in the propagation and awareness of psychodermatology in the world, in the country and around the world.
Absolutely. And as the APMNA conference grows, it'll be very helpful to have students, residents, or other colleagues that maybe don't want to be on the board but want to help out in some way, because we all want to see this conference grow, and we all want to spread this information about psychodermatology to our colleagues.
Right.
So that's a really wonderful opportunity to help it grow, is join the committees, help plan the conference, because you're right, it is a lot of work to plan a conference.
Right.
But with many hands on deck, it can actually lighten the load a lot.
Yeah, just before coming here, I had a meeting with somebody at 8:30. So one of the pharmaceutical company. So they were so impressed from our performance, I would say. And this is the whole conference, and so they scheduled a meeting with me today to discuss for the next meeting that how can we involve.
Oh, that's exciting.
So there's again is a great sign that people are getting more and more interest in this field.
Absolutely, and I'm so thrilled to hear that our industry partners are starting to pay attention to this topic, because it's so important, and I won't get into why I feel like it's really important for the pharmaceutical industry partners to get involved and to support this, but it is exciting that they're paying attention and that they're supporting.
Yeah, that's a great sign.
So I will talk to my friends in industry and help get them on board as well.
Right.
Especially because we're a year away, so we've got time.
Definitely.